Why don't we go ahead and get started? Again, thanks to everybody for being here. Good evening. For those of you who don't know me, I'm Margaret Crone, and I'm the director of the Maryland Physician Health Program. We're part of the Center for Healthy Maryland, which is part of MedChi. And we are so happy to see all of you here for our first lecture for 2026 edition of Lemons to Lemonade. If any of you had joined us in last year or the year before, you know we have great speakers, exciting and interesting topics, and we're really happy to be back in 2026. We're going to have 6 informative, thought-provoking lectures this year, and tonight we start our season with Dr. Chetna Sethi presenting Navigating Complex Microcultures, Maintaining Supportive Boundaries in Healthcare. But before we get started, just some housekeeping issues. Just a note about questions and comments. Please put all of those in the chat, and we'll hold them until the end of the presentation tonight. I'll read them out, though we may have some back and forth at the end, but please just put them in the chat. All of you attending this evening will be sent a link to the CME questionnaire in the next couple of days, probably tomorrow, actually. Please complete the questionnaire and submit it if you want to receive your CME certificate. And those certificates typically are sent out within 5 to 7 business days. But everybody should know how to get in touch with me. I'm the person that sent you the invitation, or probably most of you, the invitation to this lecture. So please feel free to contact me if you've got any questions or things don't come to you the way you think that they should. Please tonight be generous with your enthusiasm for our speaker, but also with your support of our lecture series and the work that MPHP does. Last year we helped over 100 participants with problems ranging from substance use disorder to mental health to stress and burnout to licensing sanctions. Please donate. John is going to put our QR code for donations in the chat, but please donate and give generously so that we can ensure that all who need compassionate, confidential, quality help are able to receive it. Okay, now let me introduce our speaker. Dr. Sethi is an author, lifestyle balance coach, and founder of Luminous Connections, LLC. She helps parents, professionals, and leaders reconnect with their values, build supportive boundaries, and create more sustainable, meaningful lives. Dr. Sethi holds a PhD from the University of North Carolina at Chapel Hill. She has experience as an occupational therapist, a university professor, and a community leader. She's presented, consulted, and published widely on the topics of burnout prevention, parenting, talk about burnout, and cultural change for over 15 years. Through individual coaching, organizational consulting, and speaking engagements, Dr. Sethi has helped dozens of working parents, business executives, and overwhelmed employees navigate life's complexities with evidence-informed strategies and genuine empathy. Her goal is to address not just mindset and emotions, but also the practical elements that make sustainable change possible. We are so honored and fortunate to have Dr. Sethi here with us this evening. So please join me in welcoming her. Turning it over to you. Thank you.
Thank you, Margaret. Good evening, everyone. Thank you all for being here. Good afternoon, I guess, for those of you joining from the West Coast. I'm not sure if there are any of you. However, let me start sharing my screen here. I'm hoping everyone can see this okay. Okay. Awesome. So again, good evening. I am Dr. Chetna Sethi. I am the author of a book named Cultures That Bloom, Take Your Organization from Burnout to Balance. I am also a licensed occupational therapist and owner and CEO of Luminous Connections, as Margaret mentioned, where I primarily focus on burnout prevention and lifestyle balance coaching. So before we get into the content, I know we're all settling in. I know Margaret already mentioned about the chat feature. I would love it if you can introduce yourselves in the chat, maybe your role, where you're practicing. It just helps create a sense of who's in the room. And as a quick note on tech, I do have a couple of polls embedded into the presentation. So if you're able, if you can have your cell phones handy for those. All right. So what we're talking about today is something that most people don't actually end up naming quite directly. It's not just workload. It's not just burnout. It's essentially what happens when you're doing meaningful work in systems that keep asking a little bit more of you over time. And how that changes, not all at once, but how that changes over time and what it looks like. So I'll briefly orient you to where we're going, and then we'll kind of quickly move into some of the substance. So by the end of this, you'll be able to see your environment differently, not just your own habits or responses. You'll start to notice what is actually shaping your workload, what you've been carrying that maybe hasn't been named, and how your boundaries might be being influenced, not just chosen, but being influenced by others. And this is less about adding more things to your plate, just by the way. It's a lot more about sharpening your awareness, because once you see something clearly, you will not interact with it the same way. And that's what we're hoping to achieve. So I do want to start with a simple question. And this is not anything theoretical, no ideal, perfect, correct answers, just real. Just be real and think to yourself, when does your work actually feel sustainable to you? Not easy, but sustainable. So think about a day or even maybe part of a day where you left work feeling not depleted. You left work feeling still engaged, still yourself. What was different that day? So we're going to spend the rest of this session unpacking what creates those moments. Those moments where you give and have a successful day, but are still able to have engagement and a sense of self afterwards. And we'll also discuss what things can slowly erode these moments and prevent them from happening. Now, of course, we're all in healthcare and it has always been demanding, right? But now the difference is not just about volume. There's a lot of different layers to what we are all expected to do in patient care scenarios. We're not just seeing patients. You're managing expectations. You're navigating systems. You're coordinating care. You're documenting. You're communicating with families. And often all of this stuff is happening all at once. And much of it is not actually formally defined work, which means a lot of the strain that you feel about managing all those responsibilities don't have a clear source that you can blame. And for you, then it just shows up as, oh, this really just feels heavier than it should today. So you move through multiple roles in a single shift or in a single course of your workday, right? You're a clinician, you're a decision maker, you could be a communicator, you're sometimes a mediator. And there's very little transition time between those roles. So even if you're extremely efficient, even if you're excellent at what you do, you're still carrying a really, really high cognitive load. And so importantly, there's not much built into these systems that allow that load to come back down or to take a pause or to even have any time for recovery before that load kinds of builds up again. So this is where we start to zoom in then, right? Every environment is a culture. Every environment has its own culture, but within that, there are even smaller systems, right? There's teams, there might be different units, there might be different specialties, and each one has its own way of functioning. And that the interesting thing is that those local patterns really kind of offer much more insight into what's actually going on within a space more than formal policies most of the times, because those informal and local patterns of behavior are actually what's shaping the behavior of the people that are within that group. So for example, no one may have told you that you have to stay late, for example, but if everyone around you is doing it, it stops feeling optional. No one might tell you, don't ask for help around here, okay? Do it yourself. But if no one else is asking for help, it starts to kind of feel like something you shouldn't do either. And that's how microcultures work. They don't instruct you directly about this is what your role is and this is what you should do. They show you in subtle ways what's expected of you. And these are not isolated to one place. Your experiences shift according to which microculture you might be in. It might be teams or units. It might be within your leadership framework, even at home. But the most important part is that they don't stay separate. They interact with each other. They're all a part of you and your microcultures. So the expectations that you carry, they aren't coming from one source. They're all layered. You are having expectations brought upon you from all of these different areas in your life, not just within your work environment. So now there's even more layered sense of urgency to your behavior and you're acting on this behavior. But that's when things start becoming hard to see because there's so many different moving parts. Because not everything that you carry or not everything that you're doing is assigned to you. Some of it might be emotional, some of it might be relational, some of it might be totally internal to you. You're not just doing your work, you're also managing how other people around you feel. You might be anticipating other people's needs. You're trying to prevent problems before they happen. And none of that is written anywhere. That's just how you respond. But it counts. All of it counts as work. So think about this. Think about the person that others always rely on. Say you are the one that can handle it. You are the only one that can handle it. Say you're the one that always steps in. The one who always makes sure that nothing gets dropped. And at first, we appreciate this, right? That's a really appreciated gesture. But over time, something subtle shifts. People stop asking if you can help, and then they start assuming that you just will. So this is one of those most important shifts to notice because your effort then becomes your identity. And then your identity becomes what is expected of you. So you're doing all the same things, but it starts feeling different because now you're not doing them would stand out. So if you stop doing something, it would be a problem. Suddenly people would notice that you're not doing it. And that's where the pressures start to build quietly, which is why people feel like if they stop or if they step away, things will just fall apart. So let's pause here for a moment. If you all do have your cell phones handy, there's no right or wrong answers here, but go ahead and think about which of these quietly takes the most energy from you. Go ahead and you can, I believe the poll is open and you should be able to start responding. Okay, I guess I'll give it maybe like 5, 10 more seconds. All right, so let's look at that. Let's look at that pattern here. For most people, this is not just one thing, right? It's a combination of a lot of stuff. And that's what makes it so hard to name and even harder to address because there's usually no single dominant answer. A lot of people, look at that, a third of you say that it's a combination of all of this stuff. I've actually been asked by participants in the past to make this question a check all that apply instead of a multiple choice question. And so that's why I added the last option. Thank you for participating in that. So now let's shift. Let's shift from the environment to what's actually happening internally to us. When demands are really high of us, which we've already established that they are, and the recovery is low, our system adapts, right? It has to adapt. We become more efficient. We become more responsive. We're more able to keep going. But that adaptation comes at a cost. And that might not be immediate. But over time, that cost builds up. And in this state, you're not less capable. You're just operating differently because you're coming from a sense of fight or flight. You move faster, you pause less, you decide quickly. And a lot of what you do becomes automatic, including saying yes. Not because you've thought it through, but because your system is just trying to keep things moving, because slowing down is a threat. And this is where it shows up in real time. You agree before you've evaluated your capacity to actually do the task. You push through breaks. You might stay later than you plan. And all of this is not because you don't know any better. You know these come at a cost. But because in that moment, you probably didn't have the space to choose differently. And that's where the environment comes in. So when this continues, of course, your focus is tightening. You're solving what's in front of you, but it is becoming harder to step back and really ask, is this working for me? Not because you don't care, but because you're just busy sustaining that pace that seems so urgent for you to sustain at this moment. So this is where something very small becomes very significant. You don't need a full reset, right? We're all clinicians here. You need a moment. You need a moment for yourself to go into this parasympathetic shift, a pause that is long enough to notice what is being asked of me, what do I have available at the moment, and whether those two things match up or not. And that is where the change starts. And so that pause can be anything. That pause can be a breath. It can be a moment before responding, or even just noticing your own reaction. It doesn't have to be dramatic. But that is the difference between reacting automatically and responding intentionally. That one pause. And so that brings us to boundaries. So boundaries are not rules, they're not walls, but we treat boundaries as adjustments. They are how you are able to stay in the work without the work taking everything from you. So let's go into that a little bit. Boundaries show up differently for different people, and they show up in different ways. So time boundaries might be related to how long you stay at a certain place, or how much time you give to a certain task. Task boundaries are exactly that, the tasks you take on. Emotional boundary might be what you carry with you. That's not your own. Cognitive might be what follows you home. These might be good ideas. These might be engaging thoughts of how to build and how to be productive at work, but it follows you home. And most people think about one of these, but all of us are always managing all of these boundaries at the same time. And we don't realize it because we are so fixated on physical and emotional boundaries alone. So boundary patterns over time can develop where sometimes you might tighten up your boundaries, sometimes you might stretch, and sometimes you might end up doing both in the same day. What matters is not labeling yourself as someone that has rigid boundaries or porous boundaries. What matters more is that you need to notice what your boundary is like in that moment and whether or not you are being able to create a supportive pattern of your boundary rather than one that may not be effective in the moment. So rigid boundaries are often a result of something. They're often a response to something that's been stretched too far. So you might become more protected about your energy and you might be less flexible because you are following an overload, right? There's so much that's been stretched already that there is no room for wiggle. They're not wrong. They're not wrong boundaries, but they're just often a response to something. Porous boundaries look different. You stay available. You always say yes. You might take things on that you wouldn't typically. And in many ways, this is what makes you good at your work, right? But over time, this can cost you more than you realize. And what we have seen time and again is that many clinicians operate within this boundary pattern. So this is what we are hoping to get to at some point within different domains of our life, having supportive boundaries, because those sit kind of in between the porous and rigid boundaries. They're not fixed, and they also adjust and must keep moving. but they allow you to stay engaged without getting depleted. It's not perfect, it's just a matter of sustainability. And this shifts over time depending on the task you're engaged in, or the time of life you're in, or the phase of life you're in, or the time of the sorry, the career trajectory that you're in and where you are within your career. All of those things can influence how your boundaries shift and change and adjust. So when they're not protected, however, that's when the strain starts creeping in. And this strain is typically just early signals. These are not failures. These are the signals that our body is basically telling us before something breaks, I'm giving you a sign that something is wrong. Irritability, fatigue, feeling stretched thin. These aren't just problems. These aren't problems. They are signals. And we don't often take them as signals of something larger that's brewing underneath the surface. And then that's where it all connects with your microcultures. Your boundaries are not just personal. They're shaped by what's around you, which means that if you've been struggling, it's not just about trying harder. It's also about seeing the system much more clearly around you that is shaping everything that you're able to do and are doing and are engaging in. And this is the dilemma, and this is the tension that most clinicians live in. You want to help, you want to show up, you want to be the reliable one. At the same time, you're aware of the cost, and that tension doesn't go away. But you can navigate it differently once you have a sense of awareness and a sense of what can shift within your own boundaries that can help your environment feel a little bit less restrictive in the moment. And so the key insight here is this, and this is important because a lot of people think that burnout is about caring too much, because the people that care the most are the people that are most burnt out. Research has shown us that. But it is the caring without limits or the empathy without boundaries that gets us into trouble. And over time, that really adds up. And so this is about structure. It's not about effort. It's not about personal flaw. This is actually something that we can work with because this is not just personal or individual. So boundaries don't have to be very harsh and confrontational. And this is another misconception, that you have to be very strong and powerful to be able to say something to someone. You may not have a position of power, etc., etc. They don't have to sound harsh. They just have to become practical. They have to come from a place of practicality. They can sound like things like, let's look at the timeline on this, or what's the priority here? Or actually clearly identifying, this part I can take responsibility of. It's clear, it's calm, and it's grounded. It doesn't have to be a big show or something that's resentful towards, you know, other people, or you feel is disrespectful towards your colleagues. So none of that can happen though, right? None of that shift in boundary, none of that opportunity to be able to use those practical words, none of that can happen without that one thing, that pause that we talked about. And that moment between the request and the response, that is where your choice lives. And that is where you're able to then take a step back and actually figure out what I have, what I need, and what I'm able to bring to the table. So this basically just brings us back to, where do you feel this most? Where are you feeling most stretched thin? It could be a lot of places, right? But don't think about everything. Think about one small thing. Where is something that has been asked of you that you haven't fully chosen? Think about that for a second. What is something that is being asked of you that you haven't fully chosen but are still engaging in? And so that brings me to another poll. And it should be open. So let's take about 30-ish seconds and I'll let you all respond to this one. Where do you find yourself most often out of in these situations? Okay, I'll give it a couple more seconds here if anyone else responds. Okay, so most people don't just pick one, right? And I bet this was one that felt like you wanted to pick more than one thing. And that's because it does depend on the situation, right? Moving between these situations depends on where you are and what you're doing. And that flexibility is not the problem. But not noticing that flexibility, that's what keeps it going. And that's the problem. So this model here is just a way of organizing what we've already talked about. Okay, these are not steps. These are not action steps. This is not something to complete. It's not a checklist. It's just a way to re-enter the process wherever you are. And this is it's not a linear process. You can enter and re-enter this process in any area that you choose. And we'll go over this so it'll make a little more sense. So your awareness is the first step. This is a really good starting point for most people. And like I said, it's not linear, so it doesn't have to be the first step, but I have seen that it is a very good starting point for many people. And here you don't change anything. When things are overwhelming, you don't change anything yet. What you do is you just start noticing. Just seeing what's happening in your microculture, what's being expected, what are you carrying. Just this awareness will help you see your situation a little differently in terms of your responses and your reactions to certain situations. B is for boundaries, which we already talked about. And we said these are not big moves. They are small adjustments, right? Ask yourself, where can something shift? Not everything, just one tiny place where you can make an adjustment. C is for capacity. And this is about being realistic. This is not about perfectionism. This is not what you should be able to do. This is what you actually have the capacity to do and what you have control over today. And I always talk about capacity and control going hand in hand, as control is you can either be in control of a situation, you can either influence a situation indirectly, or you have to let it go, right? Those three areas of control must be within your understanding of your capacity to be able to respond to situations. D is for daily practices. And this is what keeps things really steady over time. It's a practice. This is not something that you do overnight and you're just suddenly not burnt out anymore. It's not about big routines. It's about really small moments that keep you steady, like I said. And small, consistent actions have shown to matter much more than anything that you do just occasionally, whether it's big or small. So that consistency is key. And E is for enhanced living. And this is really the outcome. This is the outcome we're hoping for. And the outcome is not perfection. The outcome is sustainability. So you're not suddenly going to have less work. You're not suddenly going to have a perfectly balanced life, quote unquote. But rather, you're going to be able to engage in work that you can still continue without it taking everything away from you or without it depleting you completely and still keeping you engaged. So to kind of wrap up, you don't need a full reset, right? And just one adjustment can shift a lot of things over time. So you don't need to change everything. You just need a place to begin. And small changes really do matter. And like I said before, consistency, not intensity, is really key. So I wanna kind of leave a lot of space for reflection and questions and discussion here, because I want to leave you all with this final reflection about what it is, what it might be, the small adjustment that you think you could make. What would help you in this moment feel more sustainable? And what's realistic? What's in your control? And what is within your capacity? And so I do have this final poll. And this is, it's literally a type whatever you want kind of poll. So I'm curious to know 1 week from now, what do you think that you will want to still remember from today? What is the one thing that you want to take from this lecture that you don't want to forget 1 week from now? You can type a couple of words, you can type a sentence. I'm going to leave this one open for a little bit longer. I'm not sure if there's many people are probably logging in from their phones, so I guess this might be a little difficult. Hopefully we'll get to that if we are able to actually have a conversation, which I am actually really hoping for. And I do want to open it up now to questions and some discussion. You're all welcome to ask me anything that helps you make this more usable in your own settings. And so I believe, Margaret, you had said that you were monitoring the chat and that we may continue to monitor the chat or have other people ask questions. But I'm happy to take questions now and get this discussion going.
Yes, thank you so much. Please put questions in the chat. However, you are also very welcome to raise your hand. And if you just want to kind of go live with things, that is fine as well. I definitely want to thank you so much for this information this evening. And I'm also going to say I really like the polls. I think that allows us to really reflect and think about how this really affects me. How is this situation that I'm in being reflected by not only what you're saying, but then also what it's making me think. So thank you so much for that.
Right. Yes. And many times, we're in positions where we don't have the luxury to walk away from situations that are not going our way. And so we do have to, unfortunately, navigate systems that we may not have any control over. And that's where all of this becomes so much more important, is awareness about the system that you're in and how it functions and what it rewards becomes more important in order to discern how you would make decisions in that situation.
And I do think this is so relevant to so many of us who are working in healthcare right now, as the systems become sometimes more difficult to navigate. And what I've also heard and seen is that sometimes they're even more difficult to kind of figure out what exactly is going on here, and how do I respond to it in a way that makes sense. So things are not getting simpler and easier, for sure.
Mm-hmm. Mm-hmm.
So questions, comments. I see someone in the chat, awareness of and flexibility of boundaries. I think that's a good reflection of what that person probably wants to take with them from all this.
Mm-hmm. Mm-hmm. So I'd like to go back to some of the reflection questions, if you don't mind, and really have some dialogue around this in terms of small changes. If there was an opportunity to make a small change, I wonder, and I would like to pose to the group, to think about a change that feels real and doable and reasonable, but also something that could make your life easier. What that might look like in terms of either your boundaries or a change that you want to make in your environment in order to get your goals to where you want to align your goals with your actions. Any thoughts about that? And I can give you some examples. And I can give some actually personal examples, which might be helpful.
Just to note, there is a question that came up in the chat.
Oh, go ahead, so Margaret. I'm sorry. You know what? I'm going to stop sharing my screen if that's okay. And I would like to actually see people.
Sure.
If that's okay. There we go.
That's great.
Awesome. Let me get the chat open.
So a question from Dina. I get less overwhelmed with the big projects, but the daily fires that lead to people coming to me all the time, preventing me from getting my own task list done. How do you suggest putting up boundaries for the multiple constant questions and interruptions daily?
That's a really good question. And that's a really valid question for anyone that's in a position of supervising someone. They're always navigating questions from other people. I would suggest the things that I have seen work is depending, of course, in the situation that you're in. So whether you're in a hospital setting or if you're in a clinic or outpatient setting, having blocks of time that are actually scheduled as unavailable time. And those are times where people can certainly have a list of things ready for you, but if you are unavailable in those times, they just have to wait to ask you those questions, if you know what I mean. So that's one of the boundaries that I have seen being put up by people that I've worked with. Another one has been sort of a system of, I'm going to have a system of, at the end of the day, I want you to bring all of the questions to me. Or I want to have a 24-hour or 48-hour, okay, a question dump for me. Because if you keep going back on, and this is the piece that we forget, right? We are always willing, we're always able, we're always there, we're always present, because we have set the expectation for ourselves that we want to help. And that help is going a little too far in not being able to then set that boundary that you're being bothered every few minutes, not being able to do the work that you have to do in order to reply to these people. So that is exactly the situation where I would say that boundary comes in, where you would say, okay, new rules. People that ask me questions need to save them till the end of the day, or send me an email with questions if you have any. Please don't expect me to respond until the end of the day. Make everything explicit. And that's the biggest key. When people don't realize what their role is and what is expected of them, that creates this ambiguity, then can create more of this stepping on other people's toes, not realizing or recognizing that you may be stepping on other people's boundaries and stuff like that, because you're not making it explicit. I hope that helps, Dina.
Great. Other questions? Okay.
Awareness of, and oh, I'm just reading through some of the pause and the layers. Yeah, the pause and we're all healthcare professionals, and I've heard this so many times. It's always just even just a deep breath, right? When you take in 4 breaths but exhale 7. And just that longer exhale can move us from fight or flight just into this moment of, I'm safe. And most of the times that's all our nervous system needs for us to be able to make proper, better judgments. And I have seen this happen, right? And this is, we've seen this in research time and again. The people that are able to respond or wait, say like even about 20 seconds before responding, are able to make better decisions because they're taking in more information to make those decisions. So I appreciate taking that pause away from this lecture. I would hope is definitely would be of much value to you all. I'm seeing some others. Primary care. So I have and this is, and I can see that a lot of people here are from varied backgrounds. And so I would like to know, and I would like to engage people in a discussion about how this matters and how this differs from setting to setting. Because I think that this is a problem that's not just within hospital systems or just within large organizations. But I want to hear from people that are even in maybe smaller outpatient practices that are also experiencing these things. These employees are experiencing these symptoms of pre-burnout, but are not being able to express them to their employers. How do those things look different within outpatient versus inpatient settings, for example? I'm just curious if anyone wants to share that, if they've had experiences in bringing up issues or concerns in different types of settings. Wow, very quiet group tonight.
Yes.
It's okay. I love awkward silences. I thrive on them. I can
Okay.
wait. I will wait. Non-stop outpatient needs, of course. Could you be a little more specific? Because yes, um, that's a really good point, and thank you for sharing that. Because you're right. There's much more in people think that outpatient clinics don't actually have a lot going on, given that they're not part of large organizations or large systems, such as hospitals or universities. But I bet that a lot of you all that are in those private, smaller clinics, outpatient clinics, are experiencing this. So yeah, Wendy talks about non-stop outpatient needs. And I wonder what you mean by that, Wendy, if you could elaborate. Never enough hours to see the people who need appointments for chronic, poorly controlled illnesses and acute problems and illnesses, right? And here we go. This is one of the most common things. Time blocking has been useful for me. Great, thank you for sharing that, Sarah. But just sorry to jump around there for a second. I got excited for too many comments. So Wendy, going back to what you're saying, there's never enough hours to see people who need appointments for chronic, poorly controlled illnesses and acute problems or illnesses. I hear this all the time. There's a culture within healthcare and a culture within medicine, which is moving away from well being and, of course, more towards checking the boxes. CYA protocols, making sure meds are given, making sure you're spending the least amount of time with the patient that you absolutely need to be able to get that insurance coverage and then move on to the next. Productivity standards are through the roof, right? So we are all in systems that are preventing us from doing what we think is right or what we think is ethical, like putting these patients ahead of other opportunities where we could see them for longer periods of time. And that's something that isn't available to a lot of us in these settings where rules and policies might say there's flexibility, but if it's not being practiced within the actual setting, then no one's going to use it. So that's why I'm curious about, the pushback is what people always get confronted with is, but how can I push back? Why can I be the only one to push back? And which is why I say it's not pushback as much as it is awareness, right? You're naming what is around you rather than assuming that what is around you cannot be changed. And so that's where that difference comes in who might be more receptive to hearing, someone call out a boundary versus someone seeing it as a threat to them, that, oh, they feel like they want this blocked time, and it appears that they, might be there's usually this traditional sense that if people want to work offline or work from home or work where they're not visible, they're usually slacking off, right? I bet a lot of people have thought that. A lot of people have been subject to that kind of thinking. And the unfortunate truth is that there might be a certain small percentage of people that take advantage of the system. But the reality is, when you equate someone's flexibility with their productivity and their desire for ambition, that's when things start misaligning. And so your speaking up becomes less about confrontation and more about suggestions, more about making boundary suggestions that still protect your work and is able to bring up the issues that are important. I see some great comments here. Let's see. My boss only comes for 2 hours once a week to hear what the business needs, so it falls on me to handle things. Again, an extremely classic thing that I've seen. A lot of people that are in senior leadership and senior management don't have opportunities for stepping back because everything falls on them, right? A lot of people feel like they're the reliable ones or they're the ones that everything hinges on. And so they're afraid to step back. And that's the reason why this sympathetic to parasympathetic shift is so important. Because when we are in that mode of everyone needs me, and if I drop the ball, everything will go to hell. That is that sense of fight or flight that is keeping us in this alert and always on system, which is deteriorating our health. And so that pause and that subtle shift from the sympathetic to the parasympathetic, it takes but a moment, and it can sometimes create magic. But I'm really grateful for you sharing these experiences, because I just want you all to realize that you're not alone. If you read some of the comments, clicking, charting, long hours, and a lot of this becomes the issue of, where is the system stretching you in a way that is unsustainable to your health, but the system doesn't see it that way because it's sustaining the system. And it's pulling the energy out of the people that are contributing to that system to be able to make the system run. And so the big picture, of course, is that the systems change must come. But for all of us that are within these systems that unfortunately may not have control to change these systems, how do we navigate within them? And that's really where all of this work comes in, of helping yourself with boundaries, coming up with ways to soothe your nervous system, having this micro regulation, having awareness regarding your microcultures, and hopefully that engages you to do more and more to actually become a force where you set an example without being a rebel. And that actually works out pretty well for a lot of people. Never enough hours to see the people who need appointments. I saw that one already. Okay. Time blocking is useful. What is the essence of awareness if it doesn't lead to change? That's absolutely spot on. I love that thinking, because that's true. The essence of awareness is that you're trying to look for something to make possible and positive changes. So I appreciate that thought. I feel we need a union. This is Wendy. Doctors who share awareness of this crucial issues to discuss on even level with administrators who are facing financial challenges. Wouldn't that be fantastic? It's beyond a local system. There are not enough physicians willing to work this hard. Agreed. Yes. So I see that we're all on the same page and battling some of the same issues that are being fought pretty much everywhere these days, in terms of the systems that are not letting people that are within those systems actually come back to their starting position before they're stretched again and again and again. And while we are hoping for change and also advocating for change, meaningful changes for your everyday, small micro adjustments that you make every day, not only protect your boundaries, but slowly start pushing back against a system that has been so resistant to change. Because bringing up issues never seems to solve a problem, because they're isolated incidents, right? You might bring up, the scheduling system is off, and so I need help in that area. It might get addressed or may not get addressed in a way that you prefer. However, all of the other things that are around it are not changing also to support that one change you made in this X area. And so that's where, the pushback becomes so important, is little by little by little, when you make minor adjustments to your behaviors and to your cultures and to your environments, you're able to sustain a much healthier microculture. Cell phones seem to make me accessible at all times. Work emails, text messages, calls. I feel like I can never get away from it. Yes, this is the constant problem. It's the always on problem. And it's not that we want to be always on, but it's that a lot of times it's expected of us. And so, one of the things I really talk about is go back to the drawing board in terms of what your values are. Why did you enter this profession in the first place? What is it that you are doing right now that is sustaining you and keeping you grounded in that mission of being in this profession? And how is that shifting based on the environment and how you're reacting and interacting with it? And if those boundaries or if those environments are restricting in certain ways, that's the moments of opportunities. Those are the moments of opportunities where we can take a stand and set boundaries for ourselves as well as for the people around us, making this awareness much more prominent. Deep breathing when listening to patients. Yeah, excellent examples of pausing. I really appreciate it. I really appreciate you all sharing your experiences. Are there any specific questions related to your settings? Anything I could help with? Okay.
Well, please, if you do have questions, if thoughts come up later on, feel free to send them my way, and I will definitely forward them. We got another one. Recommendations when there is additional emotional burden now added when patients push back against more protective boundaries being put in place. Wow.
That's a really complicated issue, isn't it? Yeah, yeah. So this is a really hard one, and this is that dilemma that we see in clinicians all the time. This we care a lot, but how is it that you how do you tackle that guilt? How do you tackle that feeling of, well, am I abandoning my patients? Am I abandoning my and that's really then a matter of really laying out there your sense of what's valuable to you, and are your values truly embedded within at this moment helping a patient in crisis, and is it that your other responsibilities are not able or not letting you be engaged in that behavior? Or it could be that this is not in your control anymore, but you have taken on the emotional baggage of it. And so I would urge you to consider it from a point of view of capacity as well as control. So what is it that you have the capacity to give in this moment in terms of emotional support? And what is it that you have control over in this moment? Are you able to have a control over the amount of time that you can spend with this patient? Are you able to control whether you're able to have off hours communication with this patient? Are you able to perhaps have a liaison connect with them instead of you personally, if that makes the situation better? So I would recommend capacity and control, the two things there for figuring out your boundaries in that situation. Yes, I agree. It's important to be able to say, I will think about it and get back to you. And that's one of those very non-threatening ways of setting a boundary. It is excellent language to use with people that might be superior than you, or you might be reporting to them, and so it's not appropriate for you to just say, well, I don't have time for that, no thank you. And so this is a great way of say, I would love to think about this. It sounds like an excellent opportunity. I would love to give it some more thought. Or could you give me a little bit more information about the timeline on this before I make a decision? It's always a great idea to ask more questions, and that's one of the ways that setting a boundary can be powerful. Ask another question. Ask a clarifying question that will truly make your life easier, and no one will fault you for that. Everyone expects you to ask questions. Course on how to say no on the Insight Timer app. Oh, interesting. I've never heard of this. What are you saying no to when you say yes to something else? Oh, very interesting. Okay, so I see it now. So it's every time you say yes to something, it means you've said no to something else, and vice versa. So what are you giving up when you're responding to something? I see your point, Wendy. That's a really interesting way to look at it as well. Thanks for sharing that. Other questions? Any other thoughts? And I would encourage you all to reach out to me if you would like to, know more about my work. If you think that there's more we can discuss and I can be helpful, I'd appreciate that. And Margaret, I want to thank you again. I see another question pop up. I'm sorry. Any tips to manage and prioritize tasks? So this is a good one. This is a kind of daily, everyday to-do list kind of task that I like to do, and take what you will from this and disregard the rest, because everyone works differently, and everyone's method of creating a to-do list is different. Everyone's purpose of creating a to-do list is different. So for some people, lists work, and for some people don't. And so when people say managing tasks and people say, oh, just make lists and it'll be great, I don't go by that. I don't think that that's helpful at all, because people sometimes don't need lists. So the way that I approach it is, I already have like a calendar full of stuff. And I do like a weekly check-in. So I'll do I encourage people to do like a weekly check-in, taking a look at my calendar ahead. So that could be like, a 10-minute Monday morning activity, or it could be a 20-minute Friday evening activity for the next week. What does your week look like for the next X? And then what I like to do is encourage people to come up with a what's possible list every day, every morning. And this is, you already have a task list somewhere. You have a to-do list somewhere that's never ending, right? And the best part about having that list is you can prioritize it. And the way I like to prioritize it is what's urgent, what's important, and what's realistic. And so those are the ways that I prioritize on a daily basis. What are the things that are actually possible for me to complete versus not? What's realistic for me to think that I can check off? And typically I focus on 3 things. 3 to-do items on my checklist per day. I try not to go beyond that. And this is different from just tasks, right? Sending emails and things like that. But when there's major items on your list that take up chunks of your time, I would recommend going no more than 3 a day.
This has been wonderful. I thank you so much for coming and talking to us. I think looking at things in a different way, this reframing, this also saying, there's small steps that can make this really much better, and they're possible. I think sometimes we get overwhelmed by things, and as you said, this kind of fight or flight. So this has been absolutely amazing. Thank you so very much for coming here, for presenting. So much good information. I'm sending you a ton of gratitude, and I'm sending a ton of gratitude out to everybody who's been in the audience tonight. I want to thank you all so much for joining us, for supporting us. Just a note, we look forward to a lot of more great talks this year. I'm not sure how we're going to top this one, but we will. I know everybody has great ideas. So please continue to support us by coming to our lectures. Support us also. John just put a link in the chat for donations. Those are very, very needed and appreciated. So on that note, again, thank you so much for presenting tonight. Thank you all for being here tonight. Have a great rest of your evening and a great weekend. Thank you. Thank you.
Thank you. Thank you all.
I see lots of hearts coming up, and